Online school, work from home, social distance, physical distance, self-quarantine, and lockdown are new terms that are familiar to us, right? Yes, these terms are new terms used during the novelty COVID-19 pandemic. Currently, the pandemic is testing the resilience of healthcare systems around the world, including Indonesia. The ability to respond quickly and accurately is the key so that we can pass this crisis well. One of the lines that work quite significantly is the medical team. They are at the forefront of fighting the coronavirus. They deal directly with infected patients. The number of positive sufferers of corona continues to increase until these days. The honorable judges, participants, and all the audience. Each country does its best to reduce the spread of the COVID-19, and of course, each country has its own medical work system in dealing with this pandemic. Then, how is the medical personnel system used in Indonesia? What differentiates the Indonesian medical personnel system with others? Is the system used sufficiently suitable and affordable in the face of the COVID-19? So, what are the ways to promote a more suitable and affordable healthcare workforce system? So, those points are things that I will explain in my speech. The number of health workers in Indonesia is very limited. With the increasing number of COVID-19 patients are making health workers in Indonesia, distribution inequality in some areas. Most doctors accumulate in big cities. In addition, the infrastructure is not ready in many areas, and medical personnel have infected COVID-19, and some have even died. Due to the less stock of personal protective equipment and patient dishonest in consultation time. Over past 3 months, there has been a lot of information circulating that hospitals and health workers have relied on the help of the community to meet the needs of health and personal protective equipment. This indicates that without the help of the community movement, they will find it difficult to meet the need for personal safety equipment. The inability of health workers in Indonesia for handling COVID-19 is quite bad. This is indicated by the number of hospitals that refuse corona patients because the hospitals doesn't have the competence in handling COVID-19. So they are advised to go to other hospitals. Moreover, the patient condition at that time without any severe symptoms, even though he was included in the category of patients under surveillance. Indonesian government still have not changed the ability to provide healthcare system and integrate data yet. The healthcare model in Turkey focuses on planning, resilience, and commitment through effective crisis management and the strong infrastructure developed during the last year of the AK Party rule that has enabled the Turkish health system to successfully deal with the pandemic. However, the unpreparedness of medical personnel and protective equipment remains a crucial problem in the world. So, what should we do to get affordable healthcare? Ladies and gentlemen, given the limited availability of medical personnel, a comprehensive health personnel development plan is needed, right? Guidance for health personnel, which includes planning for the needs of health workers, education, utilization, as well as guidance and supervision of the quality of health workers is very necessary. Considering that the distribution and utilization of quality health personnel are still lacking, especially in remote areas, it is necessary to increase the number and distribution of insufficient health workers. Increasing the quality and number of medical personnel must be done by utilizing human resources so that the number of medical personnel needed can be known, especially when facing major problems problems such as the COVID-19 pandemic, so that medical personnel doesn't only focus on one problem. Medical can still serve other patient problem cases. The awareness of medical personnel in Indonesia in the face of the COVID-19 pandemic demands an increase. The need for health workers to support health development must be compiled as a whole, both government-owned health facilities across sectors, including local government and private sector, as well as to anticipate globalization emergencies. The increasing number of people infected coronavirus will continually burden the medical staff team, so that the increase of education for health work needs to be continuously improved to meet the development of research and technology in the health system to increase the use of technological advances. In the health sector, in the face of this COVID-19 pandemic, with advances health technology, this will certainly help medical personnel work more quickly, precisely, everydayly, and ensure the safety of medical personnel and patients. Improving integrity in the health workforce system is very important, considering the lack of integrity of the labor system. Of course, we must improve the integrity of the health workforce system by realizing the system together and consequently implementing the system that has been determined. With the experience of the COVID-19 pandemic, it is hoped that we can take the anticipatory steps in improving and advancing the workforce system in the health sector, so that it can encourage a whole workforce system that is more quality, responsive, more prepared, precise, appropriate, and available in dealing with problem cases. Whatever the change, even though they are very small, if the whole system do it together, this big shift called Indonesia Whole will definitely move and change for the better in the future. That's all for me. Faradila Devi come to High School Semarang. Sorry there are mistakes in words. Thank you for paying attention and see you.